Right, let's go back to our top story this morning. This is the IT outage across the Upper North Island in hospitals and emergency departments, birthing wards, you name it, they were affected. Joining us to respond, Darren Douglas, Health New Zealand's Acting Chief IT Officer. Darren, apologies for the issues earlier. Welcome back to the program.
You're right.
So any idea at this stage what caused it?
Yes, we know it was a hardware component failure in one of our main data centres, a commercial data centre that hosts a lot of our systems, including critical clinical systems. Difficult technical issue to diagnose. It was intermittent. It automated our failover redundancy provision, but still occurred. So it was a technical failure of a component that caused the outage.
Okay, and how old's the component?
I don't have that to hand, but it's a lot of our components are pretty old, and that is part of our challenge. We have infrastructure of varying ages and varying complexity, and part of our drive is to modernise. Part of our drive is to get those foundations stable, because we know that clinicians rely on our systems, and it's really not acceptable for them not to be there, and we try really hard to make sure that they are there.
Why did it take 12 hours to fix?
Largely because of intermittent. We responded very quickly, so we had monitoring. So we knew that the network at about 2 p.m. The network started to intermittently fail and performance degraded. So our response team commented very quickly. We had experts locally, experts from elsewhere in the Health New Zealand team across the country, as well as our vendor partners. So we have multiple vendor partners, and not just in New Zealand, but globally leading in. But it was very difficult. It was intermittent. It was really unclear where in the network it was occurring. All our systems within the data centre were continuing to run, so we knew those systems were okay, but the connectivity into the data centre was the issue.
How many people have you cut from IT since you've been acting IT Chief Officer?
We're constantly reviewing our staff numbers. We looked last year at our structure. We looked at how we engaged with our vendors. So we drove a lot of renegotiation and consolidation of vendor contracts. We've realigned our structure, and the reason for that is that while Health New Zealand is a single organisation, it's inherited teams from 20 district health boards and shared service agencies, and they weren't in a nationally aligned structure. So what we have now is an aligned structure, and that aligned structure allows us to respond with expertise.
Darren, how many jobs did you cut?
So our current headcount is 1,460, and through our change process, our starting headcount was around 1,900. The irony is that by the time that we got approval for our new structure, we actually had less people than we have in our structure. So part of our challenge at the moment is we have about 200 vacancies in our existing structure, and that is causing a bit of transition pain for sure.
Is that part of the problem here? This is what the PSA says. I mean, that's 450 odd jobs. Is part of the problem here that you don't have the staff to fix the problems when they do arise, therefore we end up with 12-hour outages?
These outages, and of course there's the Auckland outage, but we've had a number of these recently, which is really regrettable. As I say, we don't underestimate how much clinicians rely on these systems. In all of these instances, there were technology failures in terms of hardware. Our response was quick, so we had people onto these really quickly. But in terms of restoration, that is where it's taken time. We don't believe that is due to us not having the expertise either internally or with those external partners.
So that's wrong, that's false. Job cuts have not impacted the fact there was an outage or your ability to respond. That's false?
That's correct, yep.
Okay, and what about Simeon Brown came out yesterday, said actually this is the fault of the previous government because we smashed all the DHB systems together. Is that true, or is that also false?
Part of our restructure and alignment was to get to a more nationally aligned structure. And one of the things that we have been doing is signalling that we know we underinvest in our technology. We know that we need to take a national approach in order to drive maximum value out of the money we do spend. So we need more money, we need to spend it in the right way. So yes, part of this is getting to a nationally aligned, really efficient structure to make sure that clinicians can rely on the services we deliver.
All right. Appreciate you. Have they got enough whiteboards and clipboards and stuff for when the next outage happens at the hospitals? Are you checking on that? Because I heard that one hospital, they had trouble finding a whiteboard.
We have pretty well practiced downtime procedures. I mean, keeping patients safe and delivering care is paramount. So really hats off to our frontline colleagues who, it is really frustrating for them. And as I say, we need to do better to make sure these systems are there. But when they're not there, they have downtime procedures to make sure that care can continue to be delivered safely.
All right. Appreciate your time this morning. Darren, thank you. Darren Douglas, Health New Zealand's Acting Chief IT Officer.